give it a couple more minutes, or you think we should go ahead and
It's 6:05. Let's do it. Jacob says let's do it.
okay. All righty. Let me minimize my screen there. Okay. So for those of you that don't know me, I am Dr. Tracy McMillian. I'm the medical director at UNC Greensboro Student Health Services. And I'm here with Dr. Jennifer Whitney, who's the Director of Mental Health and Wellbeing at UNCG, and Alexis Powell from the Guilford County Department of Health and Human Services. And we want to thank you all for logging in to participate in our community forum titled Monkeypox Learn, Look, Locate. And the purpose of this forum is to provide additional information to folks about monkeypox, including information about signs and symptoms, prevention, transmission, and testing, as well as community and university resources that are available to those who might be affected by this disease. After our presentation, we're going to have a Q&A session where we're going to try to answer as many questions as you all might have. We ask that you, if you have questions as the presentations are going along, that you put them in the chat function in Microsoft Teams, and we'll try to answer those as we go along or during the session at the end. Also, make sure that your microphone stays on mute so that everyone can hear the presentations. We are recording this presentation and plan to make it available on the Student Health Services website at a later date. That website is shs.uncg.edu. Our website also has a monkeypox section on it and a list of frequently asked questions. In addition, it has links to the Centers for Disease Control and the North Carolina Department of Health and Human Services monkeypox page. So let's just kind of get into what monkeypox is and how we came to know about it. Monkeypox is a disease that was discovered back in 1958. It was discovered in colonies of monkeys that were being kept for research. The virus that causes monkeypox is in the same family of viruses that causes smallpox. Even though the virus and the disease were found in monkeys, the actual origin of the virus is not known. The first case in humans was identified in 1970. And the monkeypox disease was declared a public health emergency by the United States in August of this year. When we look at the statistics and number of cases, we look at the number of cases in the United States. As of today, it was updated 25,509 confirmed cases of monkeypox in the United States. And that actually represents about 38% of the world's cases that are present in this current outbreak that's ongoing. Um, in the state of North Carolina, they update their numbers weekly, and I anticipate they'll be updated tomorrow. But as of September 22nd, there were 510 confirmed cases within the state of North Carolina. What's important to realize about monkeypox is that anyone can get it. We've had individuals of different genders, races, ages, ethnicities, sexual orientations that have all tested positive for the virus. Um, However, it is currently disproportionately affecting males as well as individuals of color, particularly African Americans. When you talk about the signs and symptoms of how folks who have monkeypox present, they the symptoms usually start with what we call a prodrome, or very headache, fever, sometimes swollen glands or lymph nodes, and sometimes respiratory or flu-like symptoms. That's usually then followed by a rash, which is typically located on the face or the hands or the genital area. The rash tends to go through various phases as the illness progresses. So it may start out as small bumps and progress to blisters, and then progress to sores, and then progress to scabs. This rash can also be itchy or very painful. Monkeypox as a disease itself is rarely fatal, although there has been one case in the United States earlier this month that was attributed to one death attributed to monkeypox. That was in an individual who was severely immunocompromised. So, how is this transmitted from one person to another? There are several different ways that monkeypox is most commonly transmitted. It is transmitted through prolonged skin to skin contact with another person who has monkeypox rash, sores, or scabs. This contact does not have to be sexual contact. Um, but it could be. It also can be transmitted through respiratory droplets or oral fluids during intimate sexual contact, such as kissing or intercourse. Also can be transmitted from touching fabrics, objects, or surfaces that may have been used by somebody that has monkeypox. And the virus can be passed from one person to another from the time the symptoms start, and that could be those nonspecific symptoms of fever, headache, swollen glands, until all of the lesions, skin lesions have healed and new skin is formed underneath them. So there's a longer period of time that can be transmitted from one person to another. So how is it officially diagnosed? One thing I want to make sure that everyone knows is that if you've had symptoms or have been exposed, you need to contact a healthcare provider. You can only be tested for monkeypox if you have a skin lesion to test or a rash. There's not a blood test available at this time to check for monkeypox. And testing is widely available through commercial labs as well as state health lab. And it is available here on campus at Student Health Services. You just need to call your provider for an appointment, have a discussion, and figure out whether or not that testing is appropriate, and that can be set up. I do want to point out, though, that once the testing is done, it can take several days for the results to come back. Um, if you are diagnosed with monkeypox, the treatment um, is isolation first and foremost. You need to isolate until all of those lesions are healed. As I mentioned before, you potentially can still transmit the virus to others until all of the lesions, skin lesions, have healed and there's a new layer of skin that's formed underneath. That can take several weeks. It can take as long as 4 weeks for all the skin lesions to heal. But because there's still risk of transmission, you need to make sure that you're isolating yourself during that time. Other treatments are primarily supportive, particularly in the area of pain management. As I mentioned, the rash can be very painful, and depending on what location of the body is affected, it could affect ability to eat or drink and other functions. So, for severe cases, or those who are at risk for severe disease, such as somebody that's severely immunocompromised, there are additional treatments available that are in limited supply, and the individuals have to meet certain criteria to be eligible for those treatments. There is a vaccine that is approved for the prevention of both monkeypox and smallpox. There are several vaccines that are circulating, but the primary vaccine that's being administered in the United States is Jynneos, which is a series of 2 shots that are given 28 days apart. Initially, at the beginning of this outbreak, the supply of that vaccine was very limited. There's been increased production of the vaccine, so there's more availability of the vaccine, but it is still somewhat limited. But it is currently available at Guilford County Public Health Department by appointment. It's currently not available at Student Health Services, although we are going through the process of applying to become a vaccine site. Um, and there are still, because the vaccine is limited, there's specific criteria in place as far as who qualifies for vaccination at this point. That criteria is being expanded as the supply of vaccine is expanded so that we can include more people. I'm going to now turn it over to Alexis, who can talk to us a little bit more about the vaccine.
Thank you, Dr. McMillan. I'll just briefly introduce myself. My name is Alexis Powell. I am a health educator for Guilford County Division of Public Health. As Dr. McMillan mentioned, I'll just talk to you a little bit more about monkeypox and kind of the health department's role in prevention. Well, Dr. McMillan mentioned there's a certain eligibility to receive the vaccine. I just want to go over what that is for us currently. We're currently following the North Carolina Department of Health and Human Services eligibility criteria. And as it stands right now, anyone who has had close contact, especially within the past 2 weeks, with someone who has been diagnosed with monkeypox, or any gay, bisexual, or other men who have sex with men, transgender individuals who are sexually active, or any persons who have had sexual contact with gay, bisexual, or men who have sex with men in the past 90 days, and or people living with HIV or taking medication to prevent HIV, such as PrEP, or any individuals who have been diagnosed with syphilis in the past 90 days. So there are the 4 to 5 types of ways that you may be eligible to receive the vaccine. If you have any questions about if you're eligible, we ask that you reach out to us so we can provide clarity. If you're not sure if you fall within that, criteria, it's always best to just ask. I'll go over a little bit more about the risk, although Dr. McMillan kind of went into great detail about that. And I just want to stress that while most cases at present have been found in men or men who have sex with men, transgender individuals, gay or bisexual persons, anyone can get monkeypox. No one is excluded. Women aren't excluded. Anyone can get it. And thus, it is best for all of us to do what it takes to, prevent the spread of the virus. Um, some ways that we can do that or what precautions we can take is pretty simple. Avoid close skin to skin contact as much as possible. Try to limit areas where you will be kind of bumping up against others or rubbing against others, crowded areas like that. Just wash your hands as much as you can with, soap and water. Use your alcohol-based sanitizers. If you have symptoms, such as look for rashes or lesions on your skin, if you suspect you have been exposed to someone with the monkeypox virus, get tested. As Dr. McMillan said, there's testing at the Student Health Center. There's also testing at the health department, but we ask that you contact your primary care provider first, and then the health department, as another resource. Get vaccinated if you have been exposed or if you feel like you've encountered monkeypox. If someone has told you I may have monkeypox, but they haven't confirmed it yet, it's best that you go ahead and either get tested or get vaccinated if you're eligible. As far as resources from the health department, again, you can be tested at the health department, but we ask that you contact your primary care provider first. We do have vaccines at the health department, and as Dr. McMillan said, we're scheduling those by appointments. I'll put the phone number that you should call or that you should call to get scheduled for a vaccine. They'll go through kind of a list of, they may ask you some questions, kind of go through like a list to see if you're eligible to receive it, just so we're not wasting your time coming in if you're not eligible. So you will have to answer a few questions, but we will be happy to get you in as long as you're eligible. We're also in the process of kind of scheduling or coordinating some outreach or vaccine events that's not in clinic, so everyone don't have to come in-house, but we're trying to reach people where they are, so to speak. The vaccine event that's coming up soon and very soon in just 2 days here on the 30th. The health department, in collaboration with Triad Health Project, there will be a vaccine event there. That's the most recent one. And again, we are in works to try to schedule some more. If you would like to register for that vaccine that's coming up, I am just dropping in the chat kind of a QR code that you can scan. It'll take you directly to schedule your appointment for that vaccine clinic that's coming up. Thank you, Jacob, for going ahead and enlisting that phone number that you can call also to get an appointment. And again, I just want to stress that if there's any questions, don't hesitate to reach out to us. We have people or nurses that's in positions to answer your questions. Thank you. I'll turn it over to Dr. Whitney.
Thanks so much, Alexis. So, as Dr. McMillan shared in the beginning, I am Jennifer Whitney, and I oversee the mental health and well-being services that are offered out of Student Health Services at UNC Greensboro. And so I'm here to just share a little bit about thinking about mental health and monkeypox and the ways that those things might intersect, right? And so, much like we talked about during COVID, certainly psychological issues that may occur as a result of monkeypox could include loneliness and isolation. Dr. McMillan talked about if someone is positive for monkeypox, that the isolation or period could be lengthy, and that's really difficult, right? As human beings, we are meant to be social. We are social creatures, and that's a long time to potentially be isolated. So certainly, that loneliness and isolation, which of course are kind of I would say laying groundwork for depression and anxiety. And so in depression and in anxiety, oftentimes loneliness can be a component. Of course, whether someone is diagnosed or not, there are a lot of um, mental health challenges or concerns such as fear, right? We continue to experience this uncertainty, the just not knowing, kind of what might happen or who might I be exposed or not. And so just the uncertainty can really lead to a sense of fear. Certainly, when we're talking about isolation, or if we're talking about in the case of the person who lost their life to monkeypox, grief and loss can be a component, a psychological effect of monkeypox or really any disease, right? And then as both Alexis and Dr. McMillian alluded to earlier, right, there is also aspects or might be maybe aspects of discrimination and stigma. And as both Alexis and Dr. McMillian underscored, I'd like to just say again that monkeypox can affect any one of us, right? And if we've learned any kind of lessons from HIV, from COVID, right? None of us are immune. And it is human nature that as a result of fear, oftentimes folks will create, kind of rules that say only these people will get it. I won't. I'm safe because of, and then fill in the blank, right? That can be human nature as a way to reduce fear or make us feel more safe or more in control. But again, want to underscore the idea that monkeypox, just as COVID, just as HIV, can affect any one of us, and really being informed by Dr. McMillian, by your healthcare provider, by healthcare professionals such as Alexis, of really understanding what it is, how to prevent, how to stay safe, washing our hands, right? These are all ways that we actually do have control, and that we actually can exert and that control and hopefully reduce some of that fear, right? There is that saying, knowledge is power. And so one of the things that you can do in addition to the things that Alexis or Dr. McMillian mentioned around reducing infection rates or reducing the spread of monkeypox is also reducing misinformation and reducing or fighting discrimination or stigma. Right. And we know that discrimination and stigma can certainly have a large effect on mental health. Here at UNC Greensboro, I just wanted to mention a couple of resources as it relates to mental health, as it relates to stigma and discrimination. Of course, that includes the counseling and psychological services, which are located within student health services and can be found by accessing that website that I dropped in the chat earlier when Dr. McMillian was talking about finding information about monkeypox on the SHS website. At UNC Greensboro, for our students, we also have a bias education and support team. And I'll drop that link into the chat, and folks can make reports, can get support. And of course, that team is always looking to increase education and decrease and erase bias and hate. Certainly, bias or discrimination could fall under Title IX, which of course covers all of UNCG, including faculty and staff. And so Title IX is looking at any discrimination against or harassment of persons, based on race, color, religion, sex, sexual orientation, gender identity, right? And so when we think about ways that folks might be stigmatizing or discriminating, certainly Title IX may be a resource that someone might use. I don't think I have much else. I'm starting to see some questions in the chat, but as they pop up, it's looking like they are specific to medical. But certainly, if folks have mental health questions, I avail myself to answer those. And also just want to open it up for a Q&A component. Again, as Dr. McMillian said in the beginning, this could be a place where you unmute your mic. But of course, if typing a question in the chat is more comfortable for you, that is an option. And so I will mute myself and just let the Q&A flow.
Thank you. That was very informative. I wondered if it's possible to have a prescription for an antiviral if you turn out that you do have it, and if that would reduce the severity or the length of the course of the illness. I took an antiviral when I had the first few blisters for shingles show up, and it just stopped it in its tracks. So I'm wondering if that's something that's possible, or, is it, how would that work?
To my knowledge, there is not an antiviral at this point that has been approved for the use that you're kind of alluding to. Like in my talk before, I said that there is for folks who are at severe risk severe risk for serious disease, or such as folks who are immunocompromised. There is one antiviral type medication, but it is in the national stockpile, and it requires a lot of um, approvals to even get to administer. That's something that would likely be done through an infectious disease specialist, that level of care. Um, I have seen some reports about possibly using the vaccine in that way. Um, after early exposure, not after exposure, but if somebody that was recently diagnosed, it's not approved for that use though. And I don't think there's been sufficient data to show that it has been effective in reducing the severity of the illness.
I have another question if no one else is going to have one. I have adrenal failure. And so when I get sick, it's a big deal to manage things. Is that a condition that would qualify me for a vaccine? I don't fit any of the other criteria, but, trying to figure out how much cortisol I need to take by mouth to make sure I have enough when I have an illness that I don't have any way to know how severe it is. It becomes very challenging to manage.
As of right now, it doesn't look like looking at the criteria that the state has put forth, it doesn't look like you meet the criteria. But with your medical conditions, that may be something that would meet that higher risk level. And that would be a conversation that you would have with um, your primary care doctor to see whether or not they could get you tied into um, an infectious disease specialist to see whether or not it might be worth um, the vaccination versus the other medications. But we are very hopeful that as availability of the vaccine increases, that we'll be able to expand that criteria and more folks will be eligible for vaccination. But with what you've shared with your medical history, I think it's definitely worth um, pursuing with your primary care doctors about, it appears to be high risk in my opinion. Um, so I think it's definitely worth pursuing.
Thank you.
Mhm.
I have more questions, but I'll wait.
Anybody else have questions?
Jacob, did we do a good job? Is there anything that you should add that we didn't cover?
You did a fantastic job.
I was just looking for validation, so thank you.
We appreciate that, Jacob.
Actually, I've been on many monkeypox calls and Q&A forums, and there has not been any like psychological service component to it. So I really appreciate you adding that, Dr. Whitney.
Well, you can thank Dr. McMillian for inviting me.
The more the merrier. It's an important aspect of it that sometimes gets overlooked.
I always say that our bodies and our heads are connected by more than our neck. And, that's why counseling and psychological services and the medical clinic are in the same building over at Student Health Services.
Yep.
Yeah, thinking about it more holistically. Sarah, I see that you're unmuted, but maybe you're just unmuted. I don't know if that means you have a question or if maybe we punt it back to Rose.
No, I'm sorry, I don't. In my first time on Teams and
I know.
lost.
Sarah, we were having that conversation earlier. So yes, we feel you.
Thank you.
Did you want to follow up, Rose?
Yes. So in comparison to 3-day measles, 3-week measles, obviously it's not deadly like smallpox. Where does this fall in the range of diseases that we might have already experienced, chickenpox, whatever, in terms of transmissibility, discomfort, scarring, like those kinds of things? Those are easy questions, right?
Sure. In terms of comparing it to other illnesses, like I said, the virus itself is in the same family as smallpox. So it behaves similarly to smallpox. I can't compare the the pain levels and things like that. I know that pain is a big component of folks that are suffering with monkeypox. And when you think about, as I talked about before, the location of where the sores tend to be, talk about the face, if they're inside the mouth, people have trouble eating and drinking. So you worry about nutrition, you worry about hydration, and sometimes folks have to be hospitalized just to be able to um, maintain those things. When you talk about it being in the genital area, the ability to void and have bowel movements becomes um, potentially excruciating, and people have difficulty doing those. So those are some of the so trying to manage those symptoms as best you can in terms of pain control is the biggest focus with monkeypox. In terms of pain, that there is scarring. I don't know if it's similar um, to smallpox, because that was something that was eradicated before I was doing my training, so we didn't get a lot of training about it in medical school. But yeah, there is scarring associated with monkeypox as well. The transmissibility, and there have been discussions, and I don't think that science has landed on a definitive answers to whether or not if you had smallpox or if you had the smallpox vaccine, whether or not you have some immunity against monkeypox. I don't think that there's been a definitive answer there. So I don't think that when you start looking at the eligibility criteria, I don't think that that's why they're saying that if you're eligible, you should get a vaccine, because there's no promise that that smallpox vaccine you got years ago would still afford you any protection. Does that kind of answer your questions? As best I can, anyway.
Yes, it does.
Okay.
My mom got a smallpox vaccine right before she got pregnant with me. And so when I was a baby and I was vaccinated, the vaccine didn't take. I don't have a scar on my arm.
Okay.
I did some international travel when I was 19 and we had to be smallpox vaccinated again, and it didn't take. I still don't have a scar on my arm. But that was years ago. And I'm wondering, would it be worth getting the smallpox vaccine since it's been many decades? And in the hopes that it might help protect me. I mean, we don't know, but would it hurt? Like, I don't know how to manage that. I'm looking for alternatives,
Mhm. Yeah, the smallpox vaccine is one of those other vaccines that's kind of circulating that they use the scarification process for. Um, I think it's even, and Alexis and Jacob, you all may be able to help me. I think it's even less available than the Jynneos vaccine. And I don't, to answer your question, I don't know whether or not getting that would afford you any additional protection, especially since it's not taken twice. Um, I'd be concerned that it wouldn't take again.
Yeah.
But that's just my personal take on it. Um,
Yeah. Okay. Thank you.
I'd agree, Dr. McMillan. I'd agree with your comments to that question. I know just for us here at the health department, I think things as far as vaccines that's not related to, the current, our current times, what we're currently going through right now, what we're currently dealing with, will probably be a little bit harder to get our hands on here. So I'd agree.
Okay. Well,
Very nice questions though, Rose.
they're really good.
you can tell my master's was in public health, so my mind goes down those roads. Yes.
I'm right there with you.
Yeah, and those public health folks, they're resourceful, and you can tell that in your questions.
Do we know if there's a higher risk among the elderly? Is this something that is more severe because the immune system among the elderly is less robust? Maybe we don't have enough cases yet to know.
Well, if you look at the data from within North Carolina, the vast majority of cases are in the majority of the cases in North Carolina are between the ages of 30 and 49.
Mm.
There's only about 6% of the cases that are in folks that are over the age of 50
Okay.
thus far. So it may be that we don't have enough cases to really extrapolate it out to what would be considered elderly, because I don't consider over 50 elderly because I'm 50. So
Yeah,
I think the point that
So-
you were able to say something was eradicated before you did your training means you're not
Right.
that old.
Right.
That totally is what that means.
Exactly.
Right.
So to answer your question, so right now what we know is that it's affecting kind of that age of the kind of the middle 30 to 49, and then the next age group is 18 to 29, which is kind of a traditional college student age.
So not so much affecting children at this point. That's interesting.
Not that we have. It's been found in children in North Carolina as well as around the country, but not being reported as widely in children at this point.
Mm-hmm. Mm. Mm. Well, I'll give other people a chance to ask questions. I'm really not trying to hog it.
No, that's fine. Anybody else have any questions? All right, Rose, we're back to you.
Well, I think I've gotten most of my questions answered. You guys have been amazing. Yeah.
All right.
Alexis has this team things figured
She
out.
does. She's
Right?
done a Teams meeting or two. We're the newbies to it. She's got the
Yes.
reactions, the emojis, and all sorts of things. So
We
Yeah, I
have
haven't gone
so
for those
many
side yet.
meetings.
Well, this is really helpful. I'm sure you'll have to repeat this again or make it available because, college campuses are incubators.
Yeah, and we plan to make make it available on our student health services website. But for folks to be able to go back to and reference, and obviously if things change and the course of the illness changes or something major happens, hopefully that's not the case, we could certainly put it together and do it again. But
So do we know why it was declared a public health emergency? That seems pretty extreme for, what was it, 25,000 cases? Is it because of how fast it spreads?
I think partially the way that it was spreading initially, but a lot of times those declarations are for to allow um, the increased manufacturing of
Oh,
supplies,
gotcha.
and they were able to ramp up vaccine production um, in advance of um, it getting to a much higher number. So I think that was part of
Yeah,
the impetus.
makes sense. Well, I can't think of any more questions.
All right. Well, if nobody else has any questions, I want to thank everybody for logging in. I appreciate you taking the time to come and hear about monkeypox, and hopefully it's provided you with some additional information or reinforced what you already knew. Um, and so with that, we will sign off. I thank you all. Have a good night.
Thank you
Thank
all so much.